Ingrown nails are one of those conditions where for us as podiatrists it's our medical emergencies, because once you have an ingrown nail it is so painful and it really needs to be addressed before it leads to infection and really intense pain. As podiatrists we're probably the best suited out of all the professions to deal with ingrown nails, basically because of our training, our knowledge and our experience in doing procedures. Now when it comes to ingrown nails, there are two different phases and stages of ingrown nails. First is when you have a conservatively ingrown corner of the nail. Now we have great conservative procedures that we can do in practice to remove this portion of the nail. That's hardly painful at all and it provides immediate relief. The second stage of ingrown nails is if you leave the conservative ingrown nail growing for too long, and it actually becomes so badly ingrown that you will need a minor surgical procedure to remove the ingrown portion of the nail. Now I don't want to scare you off when you talk about a surgical procedure because it really is a piece of cake. It's done in the rooms, it's done under local anaesthetic, it's hardly painful and it does not take a long time. Some patients are quite anxious or scared about getting injections, and I'm happy to report that the procedures we do are hardly painful at all. Now for those patients that are really anxious, we have a fantastic product which is a needleless injector which actually anaesthetizes the area, so by the time you have to get the injection you absolutely feel nothing at all. Now when we come to treating ingrown nails, there's a fantastic new option available besides just simply cutting out the ingrown nail, and it's a system that relies on actually bracing the nail. Similar to what you do on teeth, you can actually use braces on the nail to actually lift up the ingrown portion of the nail, and over time you can encourage a great nail to grow through. Some patients won't always present with the ingrown nail, but they may present with what we call an involuted nail. Instead of the nail growing beautifully and smoothly out, the corners tend to curve around like that. Now those corners don't always penetrate through the skin, but they actually grow onto the skin, creating tremendous pressure. Now the bracing system works wonderfully for those nails, as well as one of the two conservative or more permanent procedures can be used to remove that portion of the ingrown nail. So if you have a nail at the moment that's either ingrown or deformed, it actually doesn't matter what. If it's causing pain, you need to come and see us. At each of our convenient locations, we have a podiatrist who actually specialises in nail surgery, and they are dedicated towards providing that one service.